need to build capacity in the field of firearm prevention science is so great that the mechanism of this type of network can really move that work forward at a much quicker pace than individual research projects.
The vision of NIH was to create a network of research sites across the country that would be working in a variety of settings with a range of populations, but that would be collectively working together to develop and evaluate innovative community-level interventions in partnership with their local communities to serve the overall goal of reducing firearm injury and death.
Welcome to the Community Firearm Violence Prevention Network podcast. We are an NIH-funded research network that focuses on collaboration between academic and community organizations to address the public health crisis of firearm violence, focusing on community-level strategies to prevent firearm injuries and death. In today's episode, we will discuss the formation of this network with Dr. Dara Blachman-Demner and Dr. Patrick Carter. We'll discuss how the vision behind this network aims to build capacity in the field of community-level firearm violence prevention through a coordinated network that aims to be greater than the sum of its parts. Our first guest today is Dr. Dara Blachman-Demner, a health scientist administrator at the Office for Behavioral and Social Sciences Research at the National Institutes of Health, and the lead NIH project scientist in this cooperative network. Her role is to facilitate the coordination of the network among the various NIH institutes that are involved, which include the Eunice Kennedy Shriver Institute of Child Health and Human Development, the National Institute on Minority Health and Health Disparities, the National Institute of Nursing Research, and the Office of Disease Prevention.
Dr. Blachman-Demner, can you explain the funding that led to the creation of this network?
Thank you. Yes, the National Institute of Health is committed to supporting scientific research to develop, evaluate, and implement public health interventions to better understand and prevent violence, which includes firearm violence, as well as the resulting trauma, injuries, and mortality that stem from firearm injury. So we received $12.5 million in funding through the Consolidated Appropriations Acts in fiscal years 2022 and 2023. To conduct research on firearm injury and mortality prevention. We then released a number of funding opportunity announcements with the goal to support a network of research sites that could develop, implement, and evaluate innovative community-level interventions to prevent firearm and related violence, injury, and mortality in partnership with communities. This vision also included a coordinating center that would lead the network by providing cross-network coordination, technical assistance, analytic support, as well as support for community engagement and dissemination efforts. These awards were funded as cooperative agreements, which means that the NIH staff provides substantial programmatic and scientific input and are equal partners in the work.
And so what are the key features of this network?
So this network of projects focuses on research that is examining community or organization level interventions that modify the characteristics of these organizations or environments and settings in order to address firearm injury prevention, as well as the underlying structural causes of firearm and related violence. These research projects will be an important addition to the current knowledge base, which has focused more on individual level interventions conducted among the highest risk population. Additionally, the structure of the network will allow for collaboration across the research teams and will support data harmonization and sharing, which will enhance the potential impact and generalizability of the study findings. In addition, and importantly, the funding opportunity required that community partners were full partners in the work from the beginning, as demonstrated by their inclusion as co-investigators or key personnel. And each site's representation on the steering committee governing body for the network includes both the academic and the community investigator to demonstrate this equal partnership. And this commitment is part of a growing portfolio of community-engaged research efforts across the NIH.
Can you explain a little bit more about the projects that make up the Community Firearm Violence Prevention Network?
Yes, so the Community Firearm Violence Prevention Network is made up of 2 cohorts of 3 research projects each, as well as a multidisciplinary coordinating center at the University of Michigan Institute for Firearm Injury Prevention. The first cohort of projects began in the fall of 2022, and these include Changing the Narrative on Firearms Violence, a community collaborative intervention. This takes place in Washington Highlands in Washington, D.C., and is a collaboration between George Washington University and the Mint Project of D.C. The next project is called Harmonizing Hospital-Based Violence Intervention Programs with a Novel Medical Legal Partnership for Equity in the Social and Structural Determinants of Health, the HVIP MLP model. This project takes place on the south side of Chicago and is a collaboration between the University of Chicago Medicine Violence Recovery Program and Legal Aid Chicago. And finally, out of the first cohort, we have a proposal to establish the Mississippi Violence Injury Prevention Program. This takes place in Hinds County, including Jackson, Mississippi, and is a partnership between the University of Mississippi Medical Center, People's Advocacy Institute, Operation Good, and Strong Arms of Jackson. The second cohort of projects were added in the fall of 2023, and they include incorporation of a health equity approach to hospital violence intervention programs, the integration of a community and hospital-based initiative to reduce gun violence in a large metropolitan area. This project takes place in Houston, Texas, and is a collaboration between the University of Texas Health Science Center and the Forgotten Third. Next, we have the Adaptable Community Engaged Intervention for Violence Prevention Michigan model. This takes place throughout the state of Michigan and is a collaboration between Eastern Michigan University and ACTIVE, which is the Asian Community Towards Visionary Innovative Environment. And finally, we have the HVIP Plus community model, which is a community violence prevention program in a southern state. This takes place in Central Arkansas and is a collaboration between the University of Arkansas for Medical Sciences and the Women's Council on African American Affairs Center for Healing Hearts and Spirits.
To wrap up, how do you see these different projects all coming together?
Thank you for asking. Although these projects really differ in many ways, they're all serving the overall goal of reducing firearm injury and death. Each project is testing innovative approaches to the prevention of firearm-related injury and mortality and includes different geographical areas, so both rural and urban, different populations, and different locations for the intervention, such as a hospital or community. I am confident that this research network will meaningfully contribute to the evidence base that is needed to address the increasing and urgent public health crisis of firearm violence, injury, and mortality.
Thank you, Dr. Blachman-Demner. We have learned that the network is supported by a coordinating center at the University of Michigan Institute for Firearm Injury Prevention. Dr. Patrick Carter and Dr. Mark Zimmerman are the principal investigators. Dr. Carter joins us to explain why the network is significant and how the coordinating center leads and facilitates the work of the network. Dr. Carter, can you explain how the coordinating center leads this network?
Sure. So the Community Firearm Violence Prevention Network, it's really the collaboration that's funded by the National Institutes of Health, which involves the coordinating center and then multiple projects that surround that coordinating center. And the coordinating center's job really is to help lead the network. It's to provide support and resources that can maximize the work of these projects, both in helping them to achieve their aims, but then also helping to be a focal point for bringing in data and other outputs from those projects and bringing those together to really amplify the work and move it forward in a great way. One of the ways the Coordinating Center does this is by providing resources to the project, so technical assistance and expertise that we have available within the Coordinating Center that can help the projects do certain things, either perform certain types of analyses of their data or to support best practices in research or implementation. And then also we work to take the data that the different projects are collecting as part of their evaluation of their interventions. And we bring that data together in the coordinating center and we can aggregate it together and analyze it in unique and interesting and new ways that can really lead to new knowledge that wouldn't be possible in a single research project.
So can you tell us a little bit more about how the coordinating center facilitates the work of the network?
Right. So this is a great question. You know, one of the unique things about this coordinating center mechanism is it's really meant to help support these research projects. And the research projects are all designed as partnerships between community partners and academic leaders in this space to test unique interventions that could be effective at reducing firearm violence in communities that have high rates of violence. The Coordinating Center is meant to bring these groups together and help facilitate the work that's being done. I think it's best probably illustrated with a couple of examples, and maybe I'll share a couple of the early work that the Coordinating Center has done. So one task early on was, as these research projects are thinking about how they're going to assess and measure the outcomes for their research projects, there was the task that the Coordinating Center helped to do, which was to bring all the projects together and harmonize that data collection across those projects. And that serves several purposes. One, it ensures we're using the best measurement available in the field to evaluate these projects, but it also means we can measure and evaluate them with common measures across the projects. It allows us to compare apples to apples instead of apples to oranges in terms of outcomes of the research. In addition, it allows us to think about novel questions that can't be answered in a single project. So if you think about it, we often are not fully powered in research projects to answer questions about how an intervention actually worked, or for whom it worked. Those are typically what we would call mediator or moderator analyses. The advantage of integrating the data across multiple types of research projects is we can start to answer some of those more nuanced questions. How does this intervention that's being tested work? What are the key mechanisms that are required in interventions in order to help achieve the outcomes we desire in terms of reducing firearm violence? But also then, for which populations does it work best and why? And those types of questions can be answered by integrating this large data. So harmonizing data collection across these projects allows us to really answer unique and novel questions at the Coordinating Center that we wouldn't be able to do in a single research project. Another way that the Coordinating Center has really helped to facilitate the work of this network is really in that community academic partnership role. One of the things that we bring as expertise to this network is a lot of experience in community-based participatory research and doing that type of work that takes decades to build up these community partnerships. And so we bring all of that expertise in our faculty within the Coordinating Center to these research projects. And they were able to sort of sit down at the table with academic and community partners and really think about how we were going to do this work as we move forward, and developed a set of community engagement principles and practices that really govern the work of the network. And that was based on not only the work of the Coordinating Center, but decades of work by the researchers in the field in doing community-based research, and also working with partners who are doing great work in their communities. And so I think by formalizing that, by developing a charter, by creating a standard for the practice of this type of research within this network, that's going to help advance the field forward. And that's the type of work that the Coordinating Center can help facilitate.
Why is it so important to coordinate and harmonize work across these projects?
Great question. So, not only can we aggregate this data across the research projects and look at common things to compare between the projects about how the interventions work and for whom they work, but we can take that data and then we have the resources within the Coordinating Center to link it to other types of data, for example, geospatial data or economic data for different communities. And that allows us to really think about some of these community level variables and how they specifically influence individual level outcomes or are associated with individual level outcomes. And that takes a level of resources that sometimes an individual project won't have, but a Coordinating Center really can have to help advance that work. And that can both be at the level of doing that for a single project that might have an interest in answering a specific question, but then also broadly across the network. And so that ability to link that data in unique ways to geospatial data, to community level data, to census data will allow us to be more nuanced in understanding both the underpinnings of the problem of firearm violence, but then also, how do we advance the solution?
And finally, what do you see as the key contribution this network makes to the field of firearm violence prevention?
That's a great question too. I think when we look at the history of the field of firearm violence prevention science, there were a number of years where there weren't researchers actively working in this space. And so we're really had a deficit in terms of the capacity of the field to answer some of these really, really important questions. And so I think one of the things this network can do that's really fundamental is build capacity to do more of this research. I think the unique nature of the coordinating center mechanism allows folks who've been doing research in the field for a long time to provide some of that technical assistance to other researchers who may be getting into the field or have been in adjacent fields but are doing work in firearm violence prevention now, and help to really create that that knowledge and capacity in a much bigger way. I think it also gives a platform and a pathway for emerging researchers who are getting into the field to get involved in these projects through either the coordinating center or through the research projects themselves. And that really helps to bring new faces and new diverse viewpoints into the field. I think the other thing that the network really does, and we've touched on this already a little bit earlier in the podcast, was the ability to bring together these projects and create really a bigger impact than a single individual project can make. And that's both through the nitty-gritty of the harmonization of data, but it's also just the ability to have a set of common goals in terms of the work we're doing and have people be able to learn across these different projects. I think our ability as a network, given the focus at the community level, to think really about what are the structural factors that make firearm violence more common? What are those root causes of firearm violence? How do we look at those, understand those, and then ultimately, how do we address those so that we're able to reduce firearm violence in our communities? I think is really one of the key contributions this network can make. And ultimately, I think hopefully lead to scalable interventions that will have the impact that we're all looking for, which is to reduce the number of people in the United States who are dying from firearm violence.
Thank you, Dr. Carter and Dr. Blachman-Demner, for explaining what the Community Firearm Violence Prevention Network is and how it will make a lasting impact on the field of firearm violence prevention research. In the next few episodes, we will hear from the first cohort of research projects and learn about their interventions. Thanks for listening to the Community Firearm Violence Prevention Network podcast.
To learn more about the Community Firearm Violence Prevention Network, go to endfirearmviolence.org.